Imagine if mesothelioma could be detected with a simple blood test. No invasive procedures, no biopsies, just a routine blood draw that catches cancer early when it's most treatable. Researchers have been working on mesothelioma blood tests for years, and there are tests available now that measure biomarkers in the blood. But do they actually work? Are they reliable? Should you ask your doctor about them? I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. And today, I want to cut through the hype and give you real information about mesothelioma blood tests, what they can and can't do so far. Let's start with what biomarker blood tests are. Biomarkers are substances, usually proteins, that are produced by cancer cells or by the body in response to the presence of cancer. These substances can sometimes be detected in the blood at higher levels than normal when cancer is present. The idea is that by looking for and measuring these biomarkers, we might be able to detect cancer without invasive procedures like biopsies. For mesothelioma, researchers have identified several potential biomarkers. The three most studied are SMRP, which stands for soluble mesothelin-related peptides, Fibulin-3, and osteopontin. Of these, SMRP has been the most extensively researched and the basis for commercially available tests. The Mesomark test measures SMRP levels in the blood. It's FDA approved, but here's the critical detail that often gets lost in marketing. It's approved for monitoring patients who already have a mesothelioma diagnosis, not for diagnosing mesothelioma in the first place. That's a huge distinction. Here's how Mesomark is actually used in clinical practice. After a patient is diagnosed with mesothelioma and begins treatment, doctors can measure SMRP levels at regular intervals. If they're dropping, that may indicate that a treatment is working. If they're rising, it suggests the cancer is progressing or recurring. This is the information that helps doctors make decisions about whether to continue a current treatment or to try something different. But can Mesomark diagnose mesothelioma? Unfortunately, the answer is that it can't do it reliably. While it's true that many people with mesothelioma have elevated SMRP levels, many don't. Studies show that SMRP is elevated in about 60 to 70% of mesothelioma patients, and that means 30 to 40% of people with mesothelioma would have a negative test, a false negative that might give false reassurance. The flip side is also true. Elevated SMRP levels can occur in people who don't have mesothelioma. Kidney disease, some other cancers, and even some non-cancerous conditions can cause elevated SMRP. This means false positives are possible, elevated levels that lead to worry and additional testing even when cancer isn't present. It's because of those limitations that Mesomark and similar biomarker tests can't replace imaging studies and tissue biopsies for diagnosing mesothelioma. If you have symptoms that suggest mesothelioma, like shortness of breath, persistent cough, chest pain, and you have asbestos exposure history, your doctor should order a CT scan, not just a blood test. If the scan shows abnormalities, you need a biopsy to confirm whether it's mesothelioma. A blood test alone, it can't make this diagnosis. Now, I want to take a quick break and say, if you're finding this information helpful, please hit the like and subscribe buttons below. It really helps us get our videos in front of more people who need to see them. And if you have any questions or topics you'd like to see addressed in a future video, note it in the comments section below. Finally, keep watching until the end of this video. I'm going to give you valuable information about accessing important resources. Now, what about using blood tests for screening people at high risk? This is where the conversation gets interesting and important. Theoretically, if we had a blood test that was both sensitive, meaning it catches most cases of mesothelioma, and specific, meaning it doesn't give lots of false positives, we could use it to screen people with significant asbestos exposure history. We could potentially catch mesothelioma earlier when it's more treatable. The problem is that current biomarker tests aren't sensitive or specific enough for this purpose. The false negative rate is too high. We'd miss too many cases. And the false positive rate is high enough that we'd cause a lot of unnecessary anxiety and additional testing for people who don't have cancer. Researchers are continuing to work on improving biomarker tests, and some newer research has looked at combinations of multiple biomarkers rather than just one, on the theory that using a panel of biomarkers might be more accurate than using any single marker alone. There's also research into microRNAs and other novel biomarkers that might prove more reliable. One promising development is a test called the MIRView Meso test, which looks at patterns of microRNAs in blood samples. Early research suggests this might have better sensitivity and specificity than SMRP testing alone. Unfortunately, this test is still relatively new and not yet widely available or validated in large-scale studies. So where does this leave us? The practical reality is that if you have symptoms suggestive of mesothelioma and asbestos exposure history, you can't rely on a blood test to rule it out. Insist on proper imaging with a CT scan. If your doctor suggests that a blood biomarker test is enough, it's not appropriate. Imaging is essential. If you've been diagnosed with mesothelioma and are undergoing treatment, biomarker testing as part of your monitoring plan is going to be helpful. Your oncologist can use changes in biomarker levels along with CT scans and clinical assessments to evaluate how well your treatment is working. That's the appropriate use of these tests. If you're at high risk due to significant asbestos exposure but you don't have symptoms, that's good. Talk to your doctor about whether periodic CT scans make sense rather than blood tests. Some patients with heavy occupational exposure, they choose to get chest CT scans every year or two to monitor for early changes. This is much more likely to catch mesothelioma early than blood biomarker testing. If you're participating in a clinical trial or research study, blood biomarker testing may be part of the protocol, but this is different from using these tests in routine clinical care. Research settings are where new tests are developed and validated, and your participation may help advance the science, even if the test itself doesn't directly benefit you right now. Now, this is really important. Don't fall for marketing that presents blood tests as simple alternatives to proper diagnostic workups. Some companies market these tests directly to consumers, and some imply that they're suitable for diagnosis or screening, but they're not. If you see advertisements for mesothelioma blood tests that sound too good to be true, they probably are. The good news is that the field is evolving. What's true about blood biomarker tests today may change in 5 years as research progresses. New biomarkers are being discovered and validated. Testing methods are improving. It's possible that in the future we'll have blood tests that are accurate enough for diagnosis or screening. We're just not there yet. The bottom line is this: mesothelioma blood tests are real. They exist and they measure actual biological markers associated with the disease. But they're not a replacement for established diagnostic methods. They have value for monitoring disease progression and treatment response in patients who've already been diagnosed with mesothelioma. They don't yet have adequate accuracy for diagnosing mesothelioma or for screening high-risk populations. As research continues and tests improve, blood biomarkers may play a bigger role. But for now, they're a supplemental tool, not a primary diagnostic method. If you're concerned about mesothelioma, Talk to your doctor about appropriate testing, which means imaging studies if you have symptoms or exposure history. Are mesothelioma blood tests real or hype? They're real tests that measure real biomarkers. The hype comes when they're marketed as diagnostic tools or screening tests. Use blood biomarker tests for what they're good at, monitoring treatment response in diagnosed patients, not for what they can't reliably do yet. For screening and diagnosis, rely on CT scans and tissue biopsies. Visit mesothelioma.net for more information about proper mesothelioma testing and diagnosis, as well as the latest research. If you need help or guidance after you or a loved one has been diagnosed with mesothelioma, call 1-800-692-8608 or use the live chat feature on our website to speak directly to one of our patient advocates. As for me, remember to post your questions below, and I'll see you next time.